All right, well, we're going to talk about back pain today. Nothing quite as exciting as multi-trauma and cybercrime, but I think equally important. So on that note, how many people in the room have experienced an episode of low back pain? It's almost everyone. And as in your professional lives, how many have attended a call out for someone who has collapsed at home and has severe back spasms and couldn't possibly survive at home without coming to the emergency department? So one of the things that is in stark contrast to a lot of the back pain therapeutic industry is when we talk to patients who present with back pain, we actually say we're not going to treat your back pain. We're going to treat the cause of your back pain. And if I effectively treat the cause of your back pain, then over a short period of time, there will be no requirement for symptom-based care. But if you don't have that approach from the outset, and a lot of the industry is that way inclined, this is what you need to do to treat your pain symptoms. And they actually don't have a paradigm for addressing the cause. And in that circumstance, you will, for an indefinite period, continue to need to address the symptoms. And typically over time, the potency of those symptom-based interventions increases from simple old over-the-counter analgesia like Panadol and Nurofen. And then as time goes on, you need more of it. And then the class of drugs starts to go up into the opioids and cortisone injections and more and more. And so that's the classic narrative that would result without addressing root causation. And that's really not following one of the critical tenets of medicine, which is a cause-based model for disease. We should always focus to address causation in conjunction with symptoms, and then that's curing the disease that causes the symptoms, okay? And that's how we generally practice medicine. But for some reason in musculoskeletal medicine, and in particular the condition of low back pain, we've kind of turned a blind eye to causation. And this particular paper, which is widely quoted within back pain research, it's one of the most quoted articles published in The Lancet, of course. It clearly says in the first paragraph in the abstract that low back pain does not have a cause. And that is a blatant mistake. It's turned the whole industry's brains off to understanding causation. And it's kind of a little bit fundamentally ignorant of the fact that you cannot have an epidemic condition without a relatively simple root cause. They go hand in hand. By definition, epidemics have to have a root cause. And if you think about your experience, maybe not so much on a day-to-day circumstance, but in general, and I certainly see it every day at work. I have my own private patients. I do medico-legal work. I do work for insurance companies. I read a lot of expert assessments of people with back pain. And to date, I have not yet read one single report from all of those disciplines that has described the quality of movement of the patient who presents with low back pain. Okay, not one, and the whole industry from corner to corner, including physical therapists, do not describe the quality of the movement that the patient displays. They'll very commonly describe range of motion, they'll describe muscle wasting, they'll describe hypersensitivity, limits of movement with tenderness, and those types of aspects. All of the neurological findings that we do on clinical examination, very well detailed, but they won't actually talk about how well a patient stands up from a chair, how well they sit down from a chair, how well they bend over to pick up a mobile phone or their glasses off a coffee table. And that's a big problem because they are ignoring functional movement proficiency. And if you look at the data, it doesn't take very long to do a little bit of a review to identify that we're kind of, as an industry, we're kind of doing very badly at addressing this condition.